Minister Hunt, thank you for your time. As we've heard, 5 confirmed cases now in Australia. How many more are being tested, and do you have fears that the number of confirmed cases will rise?
There are 5 confirmed cases as of yesterday, with the additional case of the student that you've just covered. Overnight, the Situation Room has reported to me that there are a number of cases that are being considered in each of the states and territories. Those numbers will literally change by the hour, because some cases will be cleared and other new cases will be tested. If there are additional cases, we'll work with the state authorities to make those known to the public immediately. We do believe that there is the potential for further cases to be identified and therefore to be announced. At this stage, the latest advice from literally a few moments ago before coming on air from the National Incident Centre is that all 5 of the patients are in isolation and all are stable and being well cared for.
So all 5 patients in isolation, as you say, stable and being cared for at the moment. Is everyone who's come on a direct flight from Wuhan in the last couple of weeks being tested?
So what they're doing at the moment is tracing back all contact with these patients, and so the National Incident Centre as well as border officials are working with state and territory authorities to trace back all contacts with those people who have presented and been identified, including flights where they have been, where obviously the people on the same flights as those who've identified.
I understand there was an urgent national security meeting with government members like yourself at the highest level yesterday. What was that meeting for, and did you make any decisions about national security out of that, or is it just a watch and wait?
No, the Prime Minister has obviously chaired a National Security Committee meeting, and the purpose of that is to focus on coronavirus preparedness. We have perhaps the world's most prepared system, as identified by the World Health Organization in their most recent national assessment 2 years ago. And what the Prime Minister wanted to do was to make sure that all of the elements of that are in place, being activated and underway, and that's about making sure that our tracing, our treatment, our testing, our identification and our care of patients, not just within Australia, but our care and support for people overseas in China is underway, and every possible step that can be taken is being taken.
We still had direct flights coming from Wuhan up to 5 days ago, from the 24th of January. Why did it take so long to stop those flights? Why wasn't it done earlier?
Well, this has been following the World Health Organization advice, the advice of the medical experts in Australia who are working together. Australia declared this to be a disease with pandemic potential, and so we have followed the expert advice at every step.
But was that expert advice in hindsight now wrong, because we now have 5 confirmed cases?
Well, what we have is a situation of a contagious disease which has cases around the world, and we have some of the strongest border protection measures in place around the world ourselves. We have agriculture officials, biosecurity officials boarding all planes from China, providing information, also speaking with passengers, looking for signs, looking for symptoms, and what we are doing is moving at the fastest possible pace to make sure that everything that can be done is being done, and that continues to be the case with officials meeting, seeking additional information around the clock, and wherever anything else is required, that's being implemented straight from the evidence, the advice of the medical experts.
Minister Hunt, is it correct to say that you just simply don't know how this disease is spread in terms of whether the human-to-human contact spreads the coronavirus?
No, there's a strong presumption that human-to-human contact can and has spread the virus. That's the advice from the World Health Organization, which led to the declaration of this as a disease of pandemic potential within Australia. The further evidence is emerging every day, and that's why Australia's engaged with China, with international experts from the CDC in the United States and other countries, and the World Health Organization. So there's a constant engagement. The global science on this is evolving each and every day. But the presumption is very clear that whilst it arose from the animal kingdom, and in particular most likely the Wuhan market, that what really transformed it was the evidence that this is a disease with the potential and likely with the evidence of human-to-human transference.
It's certainly very concerning, and I know you are keeping across that. If I could just turn to one other story today. Bridget McKenzie spent $160,000 into research to the economic and social benefits of shooting. That was then handed to your department. What does the health department do with such information and such a report?
Look, I believe that this is actually about the sports component. It's not a health element as such, and so I'll leave that to the sports minister.
Was it not handed to the health department though?
I think what we're talking about here is what are the social and economic benefits of inclusion in any sport. And sport as a general principle in Australia is something that we encourage people to participate in. With regards to that, I'll leave the specifics to the sports minister.
No, that's fine, but if it was handed to your department, do you have any idea what they'd do with such a report, or is it a $160,000 report that's just collecting dust?
No, in particular, any evidence provided to government is reviewed by the specific department. In particular, this would be the sports minister and the engagement there. And that's about how do you have people, whether it's in sport, whether it's in community activities, whether it's in other activities, engaged and involved for personal contact, where they're able to deal with other people, where they're getting the benefits of participation in a community activity. And that's part of sport, part of community activity, part of engagement, and something which as a general principle is encouraged right across Australia with regards to developing community links.
This report concluded that it was not possible to conclude whether sports shooters had a greater level of well-being than the general population because they engage in hunting and shooting or for another reason. Is that really what $160,000 of taxpayer funds should be spent on?
Well, I'll leave the details of the research to the sports minister.
No, but you're a minister, you're in cabinet, you have to hand out grants all the time. I mean, can you accept that it's pretty hard to stomach that $160,000 of taxpayer funds was spent on a report that's basically useless when you're looking at other organisations like Food Bank in recent times that have had their funding cut?
Again, I respect the question, but I'll respectfully leave the details to the sports minister.
So you have no concerns about that money being spent on such a report at all?
Look, thanks very much, Laura. I've provided the answer that I'll leave that detail to the relevant minister.
Minister Hunt, thanks for your time.
Thanks very much.